What is bone scan? So bone scan or bone scintigraphy is a nuclear imaging technique used as a diagnostic study to evaluate the distribution of the active bone formation or osteoblastic activity in the body. So which it is a nuclear imaging. So which radioisotope is using here? So here it is using that is 99 technetium with MDP. What is MDP? Methylene diphosphonate. Phosphonate. So everything is related now phosphate. So 99 technetium methylene diphosphonate, 99 technetium metastable MDP is used in bone scanning, and thus bone can be visualized using gamma camera. So basically the thing is, what happens, I just want to describe in the short that whenever the MDP tagged technetium 99 is put it in the body via the IV route in the patient, then there is one positron and one negatron each derived, that is 0.5 mega electron volt each one. Negatron gets away and positron, that is electron plus, which react with pair annihilation reaction, that is with the body tissue electron, that is E minus. So after the reaction there is 2 gamma ray is emitted from the patient body, and that gamma ray is captured by the gamma camera. That is the basically the nuclear medicine scans are usually performed in this way. And that one of the example is that bone scan. So advantage of this radioisotope: good localization in a skeletal system and rapid clearance from the soft tissue. Good localization in a skeletal system. So we are bone means a skeletal system, not we are talking about soft tissue. So it is a good localization in a skeletal system and rapid clearance from the tissue. Imaging technique: static 2 to 4 hours after IV isotope or radioisotope. Then aspect CT, single photon emission computed tomography, and dynamic, that is 3 phase: blood flow, blood pool, and delayed. So blood flow is immediate, that is 2 to 5 second. 2 to 5 second images are obtained, characterize blood flow to a particular area. Blood pool, 5 minutes after injection. First one is blood flow means 2 to 5 second, blood pool means 5 minutes after injection, demonstrate balance between the plasma and interstitium. Then delayed, that is 2 to 6 hours after injection. So urinary excretion has decreased the amount of radionuclides in soft tissue. Decreased uptake depends on blood flow rate of new bone formation. Sometimes fourth phase is taken after 24 hours to see the washout. It is not done frequently, but sometimes it can be done. So in case of dynamic imaging, there is typically 3 scans, at 3 times scans are taken, that is blood flow immediate, then blood pool, that is 5 minutes, then delayed, that is 2 to 6 hours. So how you will interpret it? So there are 2 spots like in thyroid: hot spot and cold spot. Hot spot means osteoblastic activity, cold spot means osteoclastic activity. What are the indications? Indications: bone cancer, bony metastasis, bone inflammation, that is osteomyelitis, not actually osteoarthritis, degenerative. So it can be also due to inflammation, but actually that is not the acute inflammation or inflammation necessity. It's actually degenerative process. So osteomyelitis. Then fractures, bone infection, that is osteomyelitis. Unexplained bone pain. Contraindication: if patient having history of hypersensitivity reaction, pregnancy, breastfeeding. If mother is breastfeeding, then avoid 24 hours after giving the contrast to avoid the breastfeeding, then you can continue, and according to the physician advice. Normally bone scan shows increased uptake in growing end of the children. That is the common thing if you do in early age in case of children. So there is a more osteoblastic activity because there is a bone formation is still going on, so it can be found, and that is the normal.